Hello everybody, my name is Vince or Vincent. I have been working in the emergency room setting for almost 17 years. So today I'm gonna share with you some tips whether if you decided to go to the emergency room versus the urgent care. So urgent care has a different setting. Urgent care doesn't set up to see critical patients. So most urgent cares, they don't have CT scan. Some urgent care has ultrasound machine and some don't. So basically, if you go to urgent care, you can only go there for a very simple chip complaint or diagnosis. You can go there for sore throat, cough, cold, flu-like symptoms. And if you fall and you think like you strain your ankles, you strain your joint, then you can go to urgent care. Or some minor chip complaint like painful urination for most which happen mostly in women. So women, if you have painful urination and you had that before and you have the same symptoms, and you want to skip the emergency room, then you can go to the urgent care for that. Even though painful urination can be another thing, not just like simple painful urination. And that happened to me when I had painful urination. I thought that it was just a simple bladder infection. I went to the urgent care and they diagnosed me with painful urination and they gave me antibiotics to go home with, and I took 7 days of antibiotics, but I didn't get better. So I decided to go to the emergency room and they did a CT scan and I had kidney infection and kidney stone. So with a very simple chip complaint like painful urination, if you go to urgent care, they can't misdiagnose you with that. So you have to be careful, whether if you go to the urgent care or to the emergency room. But it's kind of hard to decide, unless your symptoms are very clear that you are not really sick, to go to the emergency room, like cough and cold or flu-like symptoms. Emergency room. So don't go to the urgent care when you have abdominal pain, chest pain, especially chest pain. Never go to the urgent care for chest pain, because you know what? They're just gonna do an EKG on you to check your heart, and then they're gonna send you to the emergency room. So don't do that, because you end up paying the copay at the urgent care and in the emergency room. So don't do that. Chest pain, abdominal pain, going to the ER. Simple allergic reaction. If you just have hives and rashes, then you can go to the urgent care for that, as long as you don't have airway swelling. I'm talking about airway here. That means, like the throat and the tongue are swollen and you can't breathe. So those are severe allergic reaction that you need to go to the emergency room for that. But if you just have the simple rashes, redness on the body and nothing else, so then you can go to the urgent care and it's just gonna give you some oral medication to take. And what else? So anxiety and depression. Sometimes that is a chief complaint, is that you never want to go to the urgent care, because some patient with psychiatric issue, they have anxiety and depression, they ended up have to stay in the hospital for that. So never go to the urgent care if you have anxiety and depression. But if you just want a prescription refill temporary, I think you can go to the urgent care. They will be able to prescribe you some medication temporary, and then you need to follow up with your psychiatrist for that. And when you go to the emergency room, you also need to know that the emergency room very much very busy, especially when since COVID started, emergency room is like overwhelming. So if you can avoid it, so very much like it's busy all the time. One tip that when you decided to go to the emergency room is that you never go on a Monday. If you can avoid, like sometimes you're in a lot of pain and you can't help, then you need to go to the emergency room, then you can go. But then sometimes people have a choice, that they can wait to the next day or something like that. Then if you have a choice, don't go to the emergency room on a Monday, because Mondays is the busiest day of the week. If you need to go to the emergency room on Monday, you need to go there like early in the morning or really, really late at night, like maybe like 3 or 4 a.m. at night, so that it will slow down at that time. But other than that, Monday is horrible. If you have a choice, never go to the emergency room on Monday. Fridays is the same. Friday is also busy. I don't know why Mondays and Fridays are always a nightmare in the emergency room. So if you can avoid to go to the emergency room for that, please do not go, because the waiting time is gonna be terrible. It depends on which emergency room you go to. One other thing, when you go to the emergency room or go to the hospital in general, if you have pain, to take some pain medication at home. You should have Tylenol and ibuprofen at home all the time, because you can take like Tylenol or ibuprofen if you're not allergic to those medication. Do take some pain medication. That will help you a little bit while you are waiting in emergency room, because a lot of people they don't take anything. They come to the emergency room with a headache, and for headache you can always take Tylenol or ibuprofen. That's what we do in the emergency room. That we will, if you have a headache, we will give you Tylenol and ibuprofen in the emergency room. So I recommend you taking either those medication if you have a headache before you go to the emergency room. For kids who have fever, kids, everybody who come to the emergency room for fever, please take Tylenol or ibuprofen at home. That will help you a lot. And sometimes kids they have just like flu, or they just have like a common cold. They have fever, especially kids. When they have fever, they are very agitated. They cry all the time. What you need to do as parents, when kids have fever, you need to give them Tylenol or ibuprofen at home. Sometimes a lot of times kids turn around like that. After the Tylenol or ibuprofen kick in, they feel better and they play. That's what I see in the emergency room. Some kids, they go to the emergency room for fever, and then we give them Tylenol or ibuprofen, and then they turn around, they play, and then, and sometimes the wait is so long, and then the parents said, oh, my kids are better. Can I go now? Like a lot of parents, then when their kid play, and then they think that the kids get better, and then they just take their kids home. They don't want to see the doctor anymore. So that is a very basic thing that every parent needs to know. So you need to know that. You need to do that before you go to the emergency room. I already mentioned about the waiting time. The waiting time can be a nightmare on a Mondays or Fridays. So avoid to go to the emergency room in those 2 days. So you don't have to deal with the waiting time. Even though right now, since COVID, every emergency room is overwhelming. They have a lot of patients to see, and then the hospital has been full the whole time. So it is a nightmare. The waiting time is actually even like longer and longer. One other thing that I want to mention about the emergency room is that very much most emergency rooms, they divided the emergency room into two areas. One is for critical and the other one is not critical, simple. They call it like quick care, rapid care, something like that. Yeah, so they divided into like two sections like that. So those who are considered quick care or rapid care are those who have common cold, chest congestions, burning urination, something simple. You sprain your ankle, you sprain your wrist. So that is considered quick care. So those patients who come with those cheap complaints, the triage nurse, when you go to the emergency room, you will see the triage nurse first. So the triage nurse will make the decision whether if you are a quick care or not quick care. So if you're a quick care patient, they normally get to see the doctor in a different area. And then the more critical patient, so then they're waiting to see the doctor in a different area too. So some patient, they said oh, that person only just got here like a few minutes ago. How come they got called in first and then I am waiting for a few hours and you guys haven't called me? That is why, because they divided the emergency room into two sections. If you fall in the quick care area, so then you will go to the quick care area. You're waiting to go to the quick care area because they don't take the quick care area patient to the main ED patient area. So that's why. So this is really important because I think most people who go to the emergency room, they don't know that, and they always complain. They complain every time, every day. So I think this is a very important information that those patients out there, you guys need to know, so you don't have to question the hospital. You don't have to question the staff that why you've been here for a lot longer, but then we take the other patient first while they just got here. That is why, because most of the emergency room are like that. Even though some of the emergency room, they see a mix, they don't divide the emergency room in any area. They just like first really sick patient, they will take first, and then after that they will take like a mix of patient, whether if you are sick or not sick. But most emergency room, I'll tell you, they will divide it into two different areas. The rapid care, the quick care area, and then the critical area. So if you fall into the critical area, then you have to wait to go to that area, because the quick care area, they cannot see a sick patient because that area doesn't design to see a critical patient. So then that is why. So with all of this like concern, tips about the emergency room versus the urgent care, I hope this video helps you. And if you have any questions, just leave some comments, and you can always chat with me, call me, anything. I will be able to help you, not only to know where to go, but if I know anything about your disease, the disease that you have, or anything, you just leave me a comment and I'll be able to help you if I can. Thank you.